A lot of people blame doctors for not knowing about nutrition, but we're not taught it. I always say that's like blaming your acupuncturist for putting needles in you. Like, that's what we were taught to do.
I think about this, being a physician, how do your colleagues see you in a way that you're not promoting medicine, but you're promoting natural ingredients to help people in regards to their illnesses?
Since I've been doing this a long time, I actually have a really good relationship with other doctors. I actually, probably at least a third of my clientele is doctors. Doctors, nurses, and pharmaceutical reps, because none of them want to take pills. It's the funniest thing. Doctors, I've had to argue with doctors, like, you need to go get your kidney biopsy. No, they're just going to put me on chemo. I'm not doing it. The doctors are the ones that are the most resistant to taking their meds. When I first started doing this, there were some questions, but mostly just excitement. They wanted to see my labs. I showed them my labs and things like that, but mostly excitement. And I've taught rooms with over 600 healthcare professionals at a time who are literally on their feet standing ovation to learn this information. So, a lot of people blame doctors for not knowing about nutrition, but we're not taught it. I always say that's like blaming your acupuncturist for putting needles in you. Like, that's what we were taught to do. And if you're expecting something other than medicines and surgeries, you shouldn't be going to an MD. That's literally, I remember we didn't have, I'm old now, we didn't even have the cell phones that have the computers in them, like an iPhone. We had just flip phones. So we had to memorize 800 drugs a semester, what they did, their side effects, all that kind of stuff. Just programmed into the brain. Now people can just carry around a device that has it all. But that's what we were literally trained to do. Everything I know about nutrition and disease reversal came from the research and work I did after medical school. So doctors are just doing what they're trained to do. But there's high rates of depression in doctors because they all go to medical school thinking they're going to save lives. And then the reality hits that not only are you 300 grand in debt, but your patients never get better. They never get better. Seeing a rheumatologist takes months, because once you become a patient of that rheumatologist, you're there for life, because you're not going to get better. Versus in my practice, they leave, they get better, they leave, and then they send their friends and their neighbors, right? So it's a difficult profession, and I think doctors kind of get a bad rap because they think they're just drug pushers, but they're doing the best they can and they have good intentions. They just don't know better. So I found most doctors are extremely receptive. And, a decade ago, people would tell me that their doctor thought it was stupid that they were seeing me, but they would just, let's just see what happens. Now I see people who are referred to me by their doctors, or they'll tell me my doctor knows I'm doing this. They can't wait to test my labs. So the doctors have excitement and interest now. So it's changing, but not quickly enough for the people who are sick today.